Comprehensive genomic profiling is a fantastic technology. You have the opportunity to sequence hundreds, if not thousands, of genes at the same time. You get an enormous depth of information about a patient's molecular setup. The complication of this test is that you get the information about hundreds, if not thousands, of genes at the same time. And you may find that some of these cancers, especially those that are the consequence of repeated genotoxic impact, like smoking-related cancers, UV-related cancers, but the interpretation of these results is particularly challenging. A lot of institutions have moved to instituting a formalized setting for analysis. I have started the molecular tumor board at the Florida Hospital Cancer Institute, and that's been tremendously helpful as a resource for providers to actually have this information discussed in the same way like we discuss radiographic analyses in other tumor boards, to have a look at this, to match patients to potential clinical trials on a molecular basis, and also find interpretations that would make sense. Sometimes it's not that easy. Sometimes you have conflicting and confusing information, but the genetics is never meant to be easy. So those resources are tremendously important to help analyze the depth of data that has been obtained. Sometimes the reference laboratories are very helpful in providing guidance through genetic counselors, molecular pathologists, but oftentimes you find unique genetic setups that have not been previously reported. Then you have to use your best scientific judgment in terms of analyzing these tests in the first place. But I do think that most larger institutions in a multidisciplinary setting have or will move forward with the establishment of a molecular tumor board as a standalone entity beyond the typical disease-oriented tumor boards that have been provided in the past.